first I'll start by opening my sterile kit, staying in the 1-inch border while doing so. Just following the folds, basically. And now we'll don my sterile gloves. So now I will this is another sterility tablecloth that's optional to use, especially on like male patients, just to offer a little bit more sterility around the skin area. But I will not be using that today. So I'm just gonna place it on the side. Now I'll take my pan, place it over here, right next to my patient. So now, I'm actually going to turn it. There we go. So now I would take my iodine solution and pour it all over my cotton swabs, which is what I'll be using for cleaning of the genitalia area. So I would just pour that all over the cotton swabs here. And then discard into my trash can. And then I will take my lubricant and squeeze it into the tray for when I get ready to place my catheter in it to lube the catheter. Once you use all the lube, you discard of that. Now we'll take our catheter, remove the outer bagging, and discard as well. And then I'll stick the end 1 to 2 inches for a female and 5 to 7 inches for a male into the lube to lubricate, and then also place on our sterile water. That would be. So now to explain the fabrication, this area here is the fabrication. It's important to know what that is because especially for a male patient, you insert the catheter all the way up to the fabrication, and you need to know what that is so you know when to stop inserting, so you don't insert too much or don't insert enough to get urine. So now I will demonstrate on how to inflate and deflate the balloon. So inflating the balloon, you will take your sterile water out of your syringe and squeeze it in. And there you can see the balloon. And then to deflate, you pull back. And as you can see, it deflated. So now to demonstrate on how to collect a specimen from a person that you just put the catheter in, you would go to your bag, And then from this port here, you would unclamp using your specimen collection bottle, unscrew the top, unclamp this, place the top of the clamped area over the bottle nut to make sure that it does not touch the outside of the bottle nor the inside of the bottle, but right at the top, right in the center, so you're not touching the sides of the bottle to contaminate. And then collect your specimen. To collect a specimen from a person that has had the catheter in for a couple hours or a few days, you would use the clamp that you use to place the clamp on the bed to clamp the tube together, and then take a cotton swab and clean this top port here, and then place a little lock syringe on the port to draw your urine specimen out. So when you clamped it, that helped gather urine, and then the urine that you were gathering after you clamped, that's what you would use to draw your specimen from. So now to demonstrate a stat lock. So for this, you would just open it up like so. Then place your catheter inside here. Clamp it shut. There you have that. And then you would undo take off the adhesives in the back and then place it on the inner thigh of the patient to secure.